na a push we mano, they push you mano alcohol, it pushes them down. Oh, and say obi in your hernia, for instance, so that kind of hernia that comes around almost your pelvic area. No, oh, and what is the point? What's the reason? What's your waist trainer? No, or the exercise? Oh, homie. Oh, yeah, your waist trainer.
Yeah, very important. I say now, no, some medical check here. I will live for the walia. You more no. You fast. I wore a plan. Oh yes.
Abigail Ashley.
Are you okay?
Teddy made it. Etoda obreni jumadintino ya na edi apomoni atochacha.
Aye. It was there, Mamunina Akwaba. It's another Saturday afternoon. We are live on OK 101.7 FM. Meeting the Abigail Ashley. Mohoyana. Show is proudly produced by Samuel Tavio with executive producer Dr. Father Dexter. It was a major sales sorry I wadanya mia say mbacho undana siya yemame wai. Debia me catch us new bia nenyane sa. And this are the patcho pane was say odiasa da mu du de mu epipa e ma trade Amponsah
daily life activities.
Obida ya wan sorry kind no mama what say.
How do you cope with your mentality?
Debia me catch us junso amujunso ni free obi ntumi njunso sa o. Chronic kidney patients be brave omuko kolebu eko dialysis no so it's an junso muntumi njunso nti enti wo junso free now sorry now ndanya miasia and the ugo problem
obeba modern na check you was sit na mu ye me see me futu ane say
obi na mo na kuma ye the charger na aka ho ama no odanti kakra na ya charging kakra okokakra na ya charging unhu me free un charge free un ton me un ton from a bia and so still ndanya miasi hey
Mosori mohoye, jume musuye, ewiye mohoye, boto musuye, ukode mohoye.
As usual, the show is a public health education show, and yeah, kasafa oral health. Okay, say, and I know Wednesday, no, a World Oral Health Day. You celebrate your pa, Kolebu Dental unit, a celebrate sounds on a White Stones Dental Clinic, and so a celebrate sad and the pa internet. Yes, you best celebrate pa because it's World Oral Health Day. You see, you ready airbound when with you more. Oh num a doctor for nature and simpacho ye enum asem de en wo se eja ho kra Dr. Ransford Annang and Dr. Kwabena Amponsah-Kodua on Babe Kame home our studio and I discussion. Dr. Ransford Annang, yeah, resident dentist or White Stones Dental Clinic. Can I say White Stones almost as an edumedi bremu and then on my to a obafo bako some bakaya home I was shown us. Sana Dr. Kwabena Amponsah-Kodua on also a dentist or Excel Dental Clinic. On also babekaya when chibia.
Deal with your daily life activities. Good drama bills and utility.
It was as usual a motivational message for the day. Help tidbits kakra na dia one answer na yakọ discussion for the day. Na mom ene me rush shop bi mu na me hu dreamy. Me de ateho. Ye kwa me motivational messages no me ba. Shop na me remu na me hu dreamy no. Me mom abo hu komo kakra na ebia isteyi. Ana uko weni mu behi bibia mpacho me ha ho me say me ha ho nko faka enko akra nko nanti ewia so de me hu shop bi ben ha ya me chiro me say me don't say me hu a me chiro ah maka jo say me chiro nti me chiro And a motivational message no say when one door is closed, remember there is another small door open for you. And so to the bia there to no one e pese ebie. Meanwhile the clock padlock kakra bi na to ano. And so no one e pese ebie. Meanwhile no ohwe anka ohwe puma ni mu wo ho kakra. Bo say puma no another ho. And the way I catch and say when one door is open, just make sure you look around. Just look around. There might be a small hole somewhere for you to permeate. What I say, and no soon here. Who pay be na wunye sika. Oka so sikenzi. Me pacho. Sa 5 cities and now 2 cities and now 10 cities na da ho no. Who you swa ankebe boa. Who bet me dia ye bibi. So I know so that be anke be boa pa enti menga so mi de mi pesika dwete bebre sika pudro bebre ansa na maye we minimum bia or start gari business seriously on a more serious note ene obien aka show sika wa obeka say gari keke no ye nso ai na kopeso e bibi foforo but sika na no opene wenya. And that will be so. And the Garini ice water, and Garini ice water, didn't cut a crack on just sugar. This way on that we need to buy or dear no to be count. And then, or you know, none go for better Garin, or what's a Garan no matter sugar, no matter this way on diary, no matter on Katiaka. Simple, Nipana Yudani heavy. And so, Sika all yeno. It's your crop or tombi. Or not tono as you should be bankro ediswa ekotombi. So please, when one door is closed, men found sa and with the briefing debi. There's a small door open there. A home for a ninko, and obedience and nusikana yaketwa, nemum sasikano, a bit to me I be amadachi, and no say I can see amao.
Moyana, Musika Sema to say, are you okay? My girl to say, Moya.
Me ba jo me guys ni na atsna se de da na mom anano sister Kosi agwa boaje o kan sem bi wo ade achi bia okay FM morning show no so oni Kwame amu na na ebon komo o se hwenkrofo ni omo kasa ansa na wada omo ni omo bon komo asa na wada no hwe ni yie uta didi nkrofo nkokon ansa na wada no wo nso da ye papa me man can ye enti ma me nkobo star Kosi voice no ebi ono ne de na obeti ne ye enti en nkobo star Kosi voice na muntie no me dey see how my mpacho be full video na ko okay FM page no so obenya full video no ewo ho enso ukwada na odi obi ko konsa one day wan hwe ka blood pressure be kosoro enso mpacho me ndi obi ko konsa what ukwada ada wada ada me mo bi am frefro em be di obi ko konsa nche what you say
Abigail Ashley Teddy. Are you okay? Teddy made it.
Episode I mean can't say we are live on our Facebook page. Sounds so we are live on our YouTube pages, Instagram. Yeah, the tidbits kakrabe Google ho amamo. But we are live on our Facebook page. Sounds so now we are live on our YouTube page. No one send for abasokra the dada ida munyana say mo Facebook page mo share pages no na mo share page na amamo mo share na mo share na mo like it. What you say? Me hu ofori Asian ewo ho. Sounds so now David Carpenter and so abe joining me hu tando otu ewo ho ASAS and so ho but anopa me catch on say me ko rush shop bi ma me hu dream ahin shop no watasa no ha ya me hu da enne na madam was so behwe Abigail o say open to ma hu ntuma pa na bibi ye enti behwe ma me na me ko rush shop no me who dream wait the mama fa me ncha me nua be ma wa be joining here was studio live Mr. Alex Crazy or representative for fabric wholesale omo tesano haya eja
Abigail say
adumo
kase krasi
minka krasi
Yeah.
okay makani anga mimbo ni say crazy
growing up a lot of people did that me go school in here it's crazy it's Alex Kwesi Krasi.
Okay, Krasi.
Yes.
Nickname and I surname.
Surname.
This is the first time I'm actually hearing. Oh, sorry. Abazofon.
Inches for now. All right. Midasi Abi, you are an outstanding person. What a personality. I wish that wait for Niara will experience your aura. You're such a beautiful woman and a very energetic woman. And the movie studio, who what tell that's a so crowd. Hey,
so I'm not me call jogging, me call training. What I say, Makajo must say exercise is part of medicine. To me, NDD now one day now when you exercise it's not possible. I was so exercise. It's not about me call exercise. Me feel gym na swam back shop all about.
You know, I have to applaud you because me share Aterna Nation like about kidney. My mind came straight to my kidney. I was like, listen, you have to go check out.
Exactly.
And of course, if problem be one way, you put that, you correct that. Thank you so much for what you do in this very special radio show which educates people about their health. Now, I have to applaud you for that.
Thank you.
Emma being a team, amazing.
Yeah, that's it.
Well, you said that you've walked into a place where and then during there, like you will see a place like that.
That shops the only way brochure.
Of course.
US, and now who's that shops? But that shop in Ghana,
yes.
It's a whole building with beautiful clothes. Into manos, oh Jesus!
I'm telling you, I have to say a big thank you to the head honcho, the founder. A very humble man who's come to save Ghanaians when it comes to Yenterishim. You understand? His name is Kofi Opong.
Okay.
You met him yourself, a very, very humble gentleman. And of course, I have to say, if Ghanaians haven't, experienced Fabrics Wholesale GH, Ewotesano, Allied Filling Station, Nechiwo, they are missing a lot, especially those competing in the field of fashion because all the fabrics are unique,
high quality, and the prices damn so cool.
Hey, say that again. Damn so cool. So cool. So Obit, so what kind of fabrics do we sell? I have to tell you, we are the only authentic fabric shop that sells fabric all the way from Japan. We go to Japan to stock our fabrics.
Okay.
Yeah, all the way to Japan. So imagine Japan one year. Say a pad you have to dig.
Yeah.
If you want gold, you have to dig. Diamond, you have to dig.
Yeah.
You have to go deep down to find wealth, and that's what we have. And I have to tell you, we have varieties. You've seen the colors. When it comes to satin, cotton fabrics,
I saw the leather. I was like,
leather fabrics, in colors, when it comes to jeans, bibiara, epebiara, ebenya, what fabrics also. But the good thing is that when you have it, you are the only person. You are the only one aside there be me find a one row nipa maybe better, but amongst the millions in Ghana, they are the only ones who have
the
that
unique
particular
person
fabric. Et mase. If you're looking for such quality fabrics, and I always use this word, if you want to stand out amongst everyone, please make sure you visit Fabrics Wholesale GH. Now you tell me about your experience.
Oh, that's Wow, me fan saba.
Did you hear that? I'm a fan saba. I'm a fan saba. Yeah. So Obi Bisa, like so where can we find them? Where can we find? I mean, we're not far from Peace FM. Okay.
You check quite more
right.
Allied filling station. Quite be that in. Either said left or right, but be no off it, street, right?
Yes.
Then you do the right thing.
And right
beautiful
there.
building.
Beautiful,
Let me say, I know it's a beautiful building. Because
at the park, you have to search for it, and we are not because we have clients from all over the world. Eba, your shop on a weekday. Now it's a place to even connect because there you meet.
Online shopping because now say me into my online business. Now say business.
I mean, you find people from France, French-speaking countries are there. You find people from the expatriates are there. All types
those who
of
know
people
quality stuff.
who know. And let me tell you, all the top Ghanaian fashion designers, that is their home.
I know, right?
That's their home. The thing is that they don't let you know speak the fancy, let me hear. On cancho, yeah, you meet amazing people. And I tell you one thing that we stand out, that we pride ourselves of, is our customer service. Oh, you will never come to Fabrics Wholesale GH and leave the same.
I experienced
you
it.
would
and
laugh.
I actually saw it.
Yes, you will laugh, you'll be happy, you would probably want to stay there the entire day. So we are not in a rush, because what we have is it's outstanding. And when you come there, you would definitely experience quality. One good thing is that your fabric's known to. You understand?
Yeah.
And to, they are so unique. This is Japan. Obeshe Ache. What I'm wearing alone, testify to that. Hello, gentlemen. How are you? Don't you like what I'm wearing? Please say it loud. It's nice indeed. Yeah. So if you want nice stuff, please make your way there, especially if you have a school and you want to your students to look classic. Of course, also if you have a fashion school, that's the place you can come and shop for fashion. It's very affordable.
Very affordable.
I tell you, some of our fabrics are sold for like 150 somewhere, but when you come there, you can get from 45 to 30 to even
20 to 25.
Yes,
the fabric I chose, for instance, fabric near me that particular fabric, my patch. It's me who you know me say, I want this. Maybe some the boys 25 Ghana. I was like, really? I saw this somewhere. Like,
The founder is I use the word an entrepreneur. He understands the cries of the people. Though we also go through a lot from the harbor to bring these fabrics our shop, but his desires to make sure that we as people, loving people of this country, wear quality stuff that represents all of us. And I believe the dog will find his way there, and Mr. also find his way there, and at least everybody. And I tell you something, your bosses, their tailors do come there.
Wow.
Inti I tell you at this place na
actually yes.
Ni tailor no ho no bora. Yes.
Okay, so you my contact me say bi ni muti o me pese o mo beba ho no mo. Number ben na obi pese oba ho a obetimi afre for location or something.
Okay, let me first say that we are on Instagram. When you go on Instagram at Fabrics Wholesale GH.
Boom.
Yet.
Ni na boom.
Boom back.
Okay, into Fabric Wholesale GH. Ni na obeka boom say sometime.
One time.
Okay. Yeah.
One. Okay. And then of course, if you want to call, you can call on 024 57 777741.
Okay.
024 57 777741. And of course, we are at Allied Filling Station, Nichi, and we are opened Monday to Friday, and Saturday also. Saturday we open at 9:30 a.m. and we close at 4 p.m. But on Monday to Friday, you can find us from 8:30 to a.m. to 6:30 p.m.
Okay, normal working hours.
Yes, yes.
And see Fabric Wholesale or more Tessano. Tessano haya Allied Filling Station Nichi. No more.
Yes.
Okay. And the number is 0245 777741.
777741.
Okay. 0245 777741. Yes. A4.
All right.
Okay. All right. Okay. NC 0245 77 7741. Okay. And see on my numbers and then they are on Instagram. So we share nyamani bi wo ho a me pacho fabrics wholesale GH. Ni nyina boom baako. And see fabrics wholesale GH. Mr. Crazy. Answer no be free studio Hannah. Any last word answer before you leave?
We having a special sale that is 30% discount on all fabrics. It's a lengthy sale for all Ghanaians in tea. You can walk in there and of course get yourself affordable fabrics. This Easter we are treating everyone to come through and shop for the family, their kids. Almost everyone is invited, and to please do make your way there, especially men of God who are consistently changing or staging the fabrics also will make you look fabulous. Plus, we also Yepam, if you're looking for us to also engage in that, we have our own brand that is called Ebina Miche. Yes. And it's called Eagles Wear. You get the opportunity to have a tag, which is right there. Eagles Wear, very, very classic. When you come into the shop, we also have a place where you can see some of the clothes that we've sewn for men and also for women. Classic stuff into Obiara making away with fabrics wholesale GH.
There is a place for everyone when you get to the fabrics wholesale shop, Charlie.
No query.
Let your fabrics do the talking.
Yes.
Let them do the talking. As you enter, Bianca say, whoa. Oh, and Tana say, hey, fabrics wholesale. No money that's exactly what I said. Whoa. So let the fabrics do that. Okay. Thank you so much, Alex, Crazy, for passing by.
And thank you for your good work, and thank you for your producer and the entire staff here. God richly bless you and expand you the more.
Amen.
Everything is okay.
Everything is okay.
We're okay, FM.
Thank you. It was
What's it?
Okay.
Abigail, Ashley, Teddy.
It was still live on OK 101.7 FM. And Makacha Musibi are coming to talk about oral health. Now Wednesday was World Oral Health Day, which was celebrated worldwide. Obia celebrates day, no, and yes, because I think it's something we have to discuss. I'm fast that I can see this way chocolate drink almost as an edition day bremo so and I'm a Emma special ice mineral water, special drinks, almost as an day every Saturday. HF Grills, almost Abigail. Saturdays are very busy days, but we at HF Grills, we did for you, and they've did for me all this while. HF Grills, ammonia and nam, amototonium, more quail, or more rabbits, or more guinea fowl, or more Croco coco, Taki, and also HF Grills. Oh, then I'm open the fresh on the bebro, open the grill and some pamacho on the bebro. 0277 604858 0277 604858 0277 604858. Me pacho ufre HF Grills for number no. It's so open the fresh at the bebro. Sounds no open the grill and so yet the bebro. Now I enjoy. White Stones Dental Clinic is supporting a digimedi Bremokai say when it comes to anything dental services, scaling and polishing, teeth replacements and whitening, you want special services with auto dental braces and what have you. White Stones Dental Clinic or more East Legon MTN office Honmo La Bawaleshi American House Road no so more Honmo me pacho from I was 024 0452992 024 52992 from us number no just book your appointment or walk in there White Stones Dental Clinic almost say we day for you. My main share me busan for my coming home. Dr. Ransford, Annang, resident dentist, White Stones Dental Clinic in Kwabena. Dog, my sister will see Yemia is in the moment. You increase the volume. No. So my shadow na menya. Sanso na mecha Dr. Kwabena Amponsah-Kodua. Dog. Asa me share wache.
You share check.
Bibia work all there.
Nyame ado bibia.
Je radia say. Ebusiafo ho ye.
Bia ho ye.
Excel Dental Clinic for ho ye.
O muso so mo ho ye.
Okay. Ye da mu nyina say wiawe ye nyam wo studio ha. Menche my uncle street. Last Wednesday you celebrate World Dental Health Day. And it was not only in Ghana but nationwide. What was the theme for this year?
What's that here?
This year, World Oral Health Day. The theme was a healthy mouth is a healthy body. Let's just say when apomuden ekoyia oni pedua nso nyina nso enya apomuden.
Okay, and see basically about the teeth. So when you what a happy body,
a happy mouth
is a happy body.
Yes.
And but why the team? Why such a team?
Okay, and see Yahweh who say there's a direct relationship between the health of your mouth and your total well-being. We heard WHO definition of health. It just say not just the absence of disease, but a complete physical, mental, social, and emotional well-being of the person. It is more like a gateway to.
But see, I say young. Then definition in dental account.
It's part of the physical. And then
okay, it's part of the physical. Just joking.
Yes.
Okay.
Your mouth being the major gateway into your body, if that place is not well kept, it leads directly to a lot of problems within the body. Yeah.
And no, directly how? How does it lead directly?
Enti jujuemu me de kakraka de minuane ka no nti jujuemu bebre dead and I say koso ana ebi so ha it's been conclusive say mapomudin and I say or how anayare a etimi ba yenum no etimi connect it has a connection with general body health. Enti to say o here yare bi to say diabetes say
okay.
Enti say obi or wholeness or diabetes etimi say nenum no usually much say nenum no timi kwa dinini and say or reduce infections and inflammation to say gum disease and gum infection and any other oral way etimi eboa emano infect and fighting diabetes and emane bafom and at the same way so say oh diabetes and say I mean say obi or diabetes a manifest ewo nenum anase otiminya etimi yi ne ho adi ewo nenum entini nyina ye ana apart from eno so hwehwemu bebre so ekoso a linke oral health to say cardiovascular diseases clogged arteries any respiratory diseases even though say enye so much conclusive but hwehwemu a link any even enkofo to say bibi to say preterm babies any I mean preterm and a low birth weight in kwala ya wo ma omo weight no is not even up to we know the required way no nti hwehwemu dey say nti say omo issues of for men no mutini they are more likely to have such issues and are pregnant women omo ndi omenum into mutimi nya we even though say enye so much conclusive no but there's I mean we've established a link and hwehwemu koso and I'm sure that as we are progressing and I say miracle nenimo no ebetimi atiase bebre nti there's a link nti say udi wanum nia utimi prevent these infections and diseases yeah etimi funny pedua even ka it say maka akomayare bi say endocarditis ni we sayare a etimi ba akomam ni ahrawa mu ni we nyina nti so udi wanum nia utimi reduce infections from I mean from coming
yeah, just because of what do we no all those, some of these diseases can be prevented.
Yes.
Wow. Okay, so say oral health. What is oral health? Because oral health there is more to oral health, and I know because I see even the facial structure. Oral health. I'm saying, and then let's just say, as someone, it's not just but it goes a long way. So this is a public health education platform. When we talk about oral health, dog, minimum job farmer. How do you explain the oral health?
Okay, me try say me explain actually. I could do baby now. Doctor so I didn't need the account. Oral health, no, yes. To say now can there even your facial profile alone. We do a hokrana or say or bow clinic now when the facial profile you can see say something is wrong. Into your can oral health, it is a normal baby. It is share accommoding some concerning if your entire mouth, any the structures that support it. Into we won't say your upper jaw, your lower jaw, then the tongue, any your throat, all those areas no are portions or you can't say but yes, oral health these all these structures are juma without problems no. That is what we will consider as oral health.
Oral health. And see, oral health, and let's say we but there is more to it.
Yes.
Okay. Dr. Amponsah, do be better to one.
No, I can take a me de beka no say. Just say you can't oral health now. Usually, uncle for doing say was sing. But you say apart from was saying once I was saying gums, and also count, and we know. Gums na wo sina no tekrema wenum ho esro ho ene chese o tonsils nyina je ko minimum ho no kakra no so ni nyina no lips nyina nti ni nyina yare betimi akoka na chese de ono so static kan wenim dua ni nyina mpo nti chese obi wo ha the way a nyankopon si boy apantan no ne we no the way say etimi hihye no esro ne form no ebi de titimi how timi bem ene chese wenim dua ne so nyina so nti ni nyina na ka ho ye cool school yesua ho ade about we no oral health na say we dentistry no
ni nyina e ka ho. All right, so ebusian forces say na we dey fidie no etu okay fm kai say another Wednesday no they celebrate World Oral Health Day. Kolibu Dental School, White Stones Dental Clinic, Excel Dental Clinic for nyina mo Ghana nyina celebrity. Omo mo wan mo nyina so celebrity edano. Na ye di ebisa ye ho say nti celebrity we are na akaden. Because the BIA ye na celebrity and so still a problem no. Na me bisa so wa wutie me no. Afi why wa adwen say obekọ dentist akọhwe wo se ana. And also dental health problems no nti you be activate lines na check now what shall view any experience at the dental clinic. Have you been there? Are you planning to go there? And now unko bida and also you be ho komo by me what Dr. Ransom Annang or a resident dentist White Stones Dental Clinic or Minchian Waha and a Sansuna Dr. Kwabena Amponsah-Kodua on also a dentist or Excel Dental Clinic on also a Minchian. Dog not Sami Kachem so also or Sami was them polyclinic Taifa. Wow, okay, all right. Also, I was studio her. Yeah, Kasafa World Dental Health Day celebration. You see, happy mouth, happy body. So, when you any gene one sounds on our body, no so any a gene home. Now, yeah, Kassing, Macadam say if you activate the phone lines as the time goes on, then near share difference. Dog, is there a difference between oral health and oral hygiene? What's the two no difference, Beno?
Nti me aka say oral hygiene forms part of oral health, and then the basic part of oral health. Nti there's a oral hygiene is say wudi wanimu ni. Nti wudi wanimu ni a ebema in the long term ebema oral health because unya a how bibra and I say area bibra etimi ba nipa num. To set is a kaka, gum disease, I mean oral sores, I mean ekureti me ba wonum ene enunka enem say ka say yare ya ba enum ne dia bebre ana nti udi wonum ni no the eye oral hygiene no will in the long term give you oral health because yare bebre ba enum nyina most of them eba because of plaque and I say efin ba enum
yeah best start to efin e ba ni penum no efin
okay efin there most often you find dental plaque basically say on say we seen a good enum no therefore chewing say all the aduane be show na waresa nti those fine particles na ebekeka wo aduane no mu no it goes to hide in between the teeth and then a little under the gum nti if you na accumulate what we know is basically food particles. Now food particles are occur from chewing or from grinding the food into finer particles no and no na echo sheshe esinase any gum nase then it causes problems.
Na obia no didi e fi ko sheshe do na ase no cause sheshe nisim.
Most often who say it affects a lot of people and most people have because the way arrangements no what we know there are some small spaces between each tooth maybe almost there are some small spaces even though say some people have wider spaces almost in but most people know who say there's these small gaps it creates a nice harbor for particles of food to go and hide.
Dog, we didn't say master. Me bana madam for baby some your friend Bra Clement. I say, Pacho bisa question we mama. Also who doctor me bisa question baby bisa. Me Pacho I didn't know bureau nama na nam na ko kanisimu. The question of person bisa no. And I'm saying don't jai nam no ri o si o dey jai. I me the question no me bisa man because already nam bia na nam akoko kanisimu. Is it normal?
Oh yes.
And yare.
Is that the menu and no work no. On say nkofo bebre na nipa ne dodo na ya no mo se no esini bom ebobo ho bebre even though say nkofo bisuso de o ha emu atetintem kakra nti omomo de ya na they don't usually have because ho no aduane timi coin force of ana wasaresa wade ba bebre na ya majority ne space ni muswa nti udidi aduane ne bitimi koshe hote say nam typical etimi koshe usini ntemu sa ana afi so dia na etimi so ba na say bi asa o starting na unya esen gum mu yare ana say for ni friend gum disease ana periodontal disease ana fe yare I start into obi wo ha ana ne de no extreme say bia we once esen anka sana she dompe ene namnim anti si yare etimi ba o say dompe ne ene namnim ama afi spaces. Now, I say there's a normal anatomical space. I say, dear, but be more dear no height, me quetry. Into just say, uncle for no so or resabi and as or written and on benya more, food packing there. To call the boy or cry to me money a horn crown any because irritate structures in there. And I be on to so a bit me akobase when ya cavity be starting from. Afresh intina a create space so the baby and betimi ahye ho nti who say nya say onya sa problem na as I say we used to pick anywhere but he has to know exactly or so bani hutimi what is exactly causing it say the be a betimi address it no etimi arenenam because enam need ade do be happy
but enya yare
nti betimi it could be say be a to say space na or normal space but betimi abanso say yare ba the same
yeah ni so minja ne life man no onum nsuo kro be yinisi still live on OK 101.7 FM. The name is Abigail Ashley in the studio with Dr. Ransom Annang, resident dentist, Whitestones Dental Clinic. So I have here with me Dr. Kwabena Amponsah-Kodua. He's a dentist from Excel Dental Clinic. We're still talking about the World Oral Health Day. Happy month. happy body and so we num any gina ho a sounds on our body any gina maybe so question say we are sure pa say we num na ho no any gina ho ana question aye bisa enche me say me activate the phone lines and any issues with the dental problem, any dental services you need or general dental care services you need, just call us on the numbers when activated. The doctors are here to help you out, solve it. Dog, yeah, share yes, formulation angasa. What is the teeth made up? Definitely we can't talk about dental health without talking about the teeth. Nina counts the kind. Now, Maka say, oral health, it boils back to the tongue, the other reference structures holding the teeth and all that. But yeah, share the same structure and said yes. After we are near share some of the diseases that are likely to affect the mouth, because mouth won't be the oral cavity.
Okay, nti ufa esia. Basically no esia has 3 layers. Yemfa nti ufa esia na utwem into half a. Ohwe on the side, obo say there were 3 different layers. The outer layer na the first layer na ohunu. Your friend enamel. Eno na the white part na ewo ye num ye de reside ye. And eno so na the very and then the hardest part of the entire tooth. The second layer no, your friend no dentin. And no, and also ewa holding kakra, but enti say white part na, enti say enamel no. Dentin no, and no so the color ni some a little bit yellowish than the enamel, which is white, and also has a more sensitive. I say a bit more sensitive than enamel. Now you call in fin wa your friend pulp. Na pulp no hona the center of sensation. And I say hona moja any atinka ewo bias in one kasa. Nti esin wo is divided into 3 layers. Now the surrounding structures na ye kano number 1 esin is embedded, and I say eshe dompenum na on top of the gum, on top of the bone is gum, and I say gum cover dompeno ehon. Then we have certain structures which help the tooth to remain within the socket, dental socket. Baby potia esene eshe wo dompenum. There were structures be a periodontal ligaments and a fibers are a hoodie eseno.
As a socket to be a BB room.
Exactly.
Okay.
To say so between the sabon say first 2 days no or so hwemi romo who say to krobia beda. Hona eseno eshe ewo dompenum. This is in a nutshell no how eseno etie say it is made up of 3 layers, and then it is inside the bone, and it's held by all these structures, and it is covered also by gum up to a certain level.
As you grow with your teeth.
Yes,
exactly. And the obey then abohobine. Now I'm making sure say me no me sine gu menum no me pese me din yin se de tie pepepe.
Nti I'm say we start about oral health, and I say oral hygiene. Indeed. And no wo like on your part as a patient, and as an individual, no, ubeti me I prevented some of these diseases, and I say said the way Yankopon si born no say me no or describe pa me say sit here I should don't no it is an I come from enamel white no eba dentin eba pulp no eba we no sa structures na eba be she we no we can say alveolar bone no don't pay na shame in sockets ni nyare betimi aba all these places enti as I say ye di enum ni said e be ya I mean, as a patient and as an individual, no, my area, and I say area no cry a bar. Sometimes over to me are prevented to an extent, but a bar a bit me a hunting tem. Anti a secondary prevention. Into say, yeah, preventing the first one is a area no crime, but in say, Ubi no bit me I can say, be most of us, Ubinti can say, Unya malaria, but yeah, say be a malaria, the quite a bit me a cuckoo, and I say, into first one, but try to prevent, say, we know, but at the same time, so say a bar. Ubetimi esia no kwan because you say most I mean say in kofu bebre yeah at I mean like at dentistry they try to report, but we still need to I mean emphasize on the education out there because in the past then most people will try and then wait till last minute and say obebana na jaw na hono and I say we're in severe pain and say no but thankfully now because of technology and I mean these platforms it's me at the education equity as I say it says utimi do any money nyina enim say say utwitwi o say no pani enyumre at one of them I mean basic we nti na afi so be use brush brush no
nyina na enim say utwitwi asi no pani enyumre who was anti I normal normal still like we still struggle to do the 2 times brushing.
Yes. Nti me do abia na me dwene say bia na eni hakakra but say the oka no say bia nye obi ananim nti na so we need to I mean emphasize on these things say the be ankofo beti ase nti I say ti say the waka no bodwitwo osi anopa na enwumre obi su brush ano yemre nti ana say they are no broni ebe kan say I mean soft to medium brush into nkofa de ano heading hard brush no utwitwi osi a obi gina chi kro obeti say utwitwi osi eno de obese osi no o de how be brain ebebro na face so obe floss osi obe use sa homa na edi ti say de kan say sinin temu no e space na very very small nti aduane so timi ko hye ho ana nya ho no so brush ni ntimi nko nti esa o floss o didi wi a brush it twice and at least you recommend say at least once daily the obetimi a floss so say said e be a untimi aduane na afi so brush o sense so a most important thing say na you really see be brush your tongue so nti esa you cut the takreman and also e fin ne moamoa etimi ko hye ho
ye takreman moamoa ko se ko
yeah nti and etimi my bad yes they say no so spaces also especially echi o kakra na anyway nti say yeah brush ni na you get rid of I mean
with the same toothbrush.
Yes, with this but there's also for the tongue you can use a brush but you can also use a tongue scraper. Okay. I know you're quite easy. Once a brush, you need to how being not so much comfortable using a brush, but you can still use it. I mean, a soft one to say the OD. But there's a tongue scraper. So I'll be to me clean your tongue, and then I in such a way say, oh, they say, oh, paper or tongue, and so yes, now we're clear. I mean, excess bacteria and any winning in every so the bear obenya minty just say. Basic oral hygiene, no dear, and then you can use a mouthwash in addition so that it will be reduced to, I mean, plaque formation. Once it is a plaque now, I can, and also antimicrobial will be reduced.
But plaque now can where there?
It is a fee no I buy a no. It's once a plaque.
White, allow black.
It's a no. Once a static plaque no. Estate as so didi a eduane na ebeka no na afi wanum no ntasu na ewo nim na saliva no no ebe form pellicle bi ewo ho nti gradually na forms a plaque no saa we no nti no de obetimi a the brush up atwitwi amanako nti but once it takes a longer time no then it becomes hard na yellow a friend calculus nti no so etimi beda esene so ana se betimi ada gam na se nti ni nyina so ade atimi ecofact dental caries periodontal disease kaka ne sinu yare ne ni we problems na ya kan nyina no nti in simple terms no sa na tie
and it's a fact ni say when you osia e na kaka ne ba
yes
but enye say ebusia yare bi
Oh, the internet said dog better us.
There be.
Enye busia yare.
Enye busia yare.
Kaka nye busia yare.
Kaka nye busia yare.
Tete mo manya kaka ni nyina na cheso mo ntwitwa musi. Me be say etum yiye na nkofo ti ase.
That is the basic and the logical truth. Kaka is based on your oral hygiene. Say obi wo ha ondi nenum eni and I say on take good care of the teeth no. And that is what will lead to kaka. Until if you can say it's family, then it means the way they do the way they take care of their health, they pass the same tradition on from mother to child until they all tend to have similar symptoms. See, that's the only explanation about me I must say. But and you say bibia one mama ho ani mama de ama ne ba. No, basically the practice how you keep your mouth no and related say kaka and say caries
and so obi akaka woni no but to make catch nipa no as a won't choose.
Oh yes, I mean it's sound it causes that and other factors.
Okay, it's but obi wo we twitwinese like every day brush than no mo to nipa yi de twitwinese pa na so still or sa nyama no me no say dey
most often if the case I may share that obia or say they say about 3 or 4 times a day, but or me so far me come across obia say they say ye pan or
carries
and our carries, but most often obi now what I have encountered in my practice is obi say he brushes 2 or 3 times every day, but still feels that our
company when
and no borders on another whole diagnosis called halitosis. It's a whole discussion on its own. Yes, but for obia because the way kaka forming and I said the how it happens now, you need 3 major ingredients and 3 major things to be present. Number 1 food particle and I say food substrate. Aduanena sino must be present in your mouth. Secondly, bacteria and soap should be present. Then the third one is time. If these 3 factors come together, then it leads to caries formation. I say kaka. Sometimes obi wo ho a otwitwi ni sa no pa or go through the day he eats everything and anything. Sometimes I recommend say rinsing your mouth after every meal is also a very important step to
so what did you know so what did you see some fruit
yes say only baby I mean it's not even advisable to be brushing too often, but to rinse your mouth and get rid of some of these particles, you know, it also goes a long way.
Now that say no say rich chewing gum now I know you're different.
Well, chewing gum
and teacher say they said they work no say once they have some local factors be so aha obi wo ha na ne se no ebi obeka cho so me brush me se pa but they said they no can na ebi in the course of the day no consume some other these carbonated drink these refined sugars na etimi emo na etimi didi so on microorganisms na etimi feed on to produce the acid no and ebi won so a ne se no nkasa no they said ne or your friend crowding ne se ne bobon ho bebre and even though say otwetwe ne see no you still have some food particles be a ehhehye ho intimi nko and then it still forms a substrate microorganisms in betimi feed on to produce the inti obetwetwe de but once you still we've not gotten rid of the plaque and say or hodia inti be at say or bad feeling be she ho ma won you utwetwe osi intimi clean and as ebu okra brush na o use no enye brush etimi clean e be a borobe 3 months and as we inti no enye that enye good for cleansing and you know betimi akwa into you might be doing it in even obo akra the way I see brush o se no e be na on brush ni yimpo There's a mechanism I say utimi in a round circular motion obetimi akọ sini hu nyina said the bear obetimi get rid of the plaque no. It say and it said na oka no. You don't necessarily need to be brushing your teeth like all the abu help say or reduce cavity formation till did we are not brushing it. And if you are not crying no it's that we've been advised not to do that because on say eduane bi or how dear ana acid kakra into the more rounds after eating all tries or be brush or sina a bit protective layer no once you are applying the mechanical force of brushing a bit me appealing off because there's an acid it is advised that at least so person brush your cry you should wait after 1 hour after eating so the bear nyankopon no obo no saliva no and anteso na we no body friend bibi or some buffering action bi or ha it reduce acid content no but no it takes some time. And for it to happen to reduce the acid load and all that, and it will take about an hour or more. Until now, then you also make sure you are doing the brushing well, and then there are also no local factors. They said they may be also how crowding would be also no cavities be that and also some artificial prosthesis be and also to say replacement ABI and she. And I say unkipunini and no crown chuchi obu ha o chuchi ne senes or artificial TTB to say den chakra or chuchi ne sen also. And these are all local factors unkipuni krania a bit amount issues but because we made them a brush missing but these things into oba dentist who a bit me church na because we be on a peculiar issue we be on a day I say emphasize or dentist who it me emphasize on say the bear unya problems be brave.
Obia one peculiar issue na me bisa say what dentist afi ana afi na wo hye ana wo ye wa dwen say obekọ dentist akọhwe wase na what could be the cra share your experience with us 0302243547 0302243547 and 0302243529 my activated phone lines no have you been to the dentist before? Do you want to share your experience? Are you getting ready to go to the dentist this year? 0302243547 0302243547 and 0302243529 your activated phone lines no bet to me afre ache wadren dear cousin ya esi ya high beji ama hello umohoyana
Pacha now
me pacho yes ya hu ya udini baby akase film pacho
yes feme nana kwa me kata fi
bra kwa me pacho lo wa radio na nke be me da pa
Pacho now for how long now we use to brush the teeth?
Oh brush no me pacho maybe say a doctor for no more answer ma dog me pacho on the problem is a person for how long do you have to use your brush?
Okay, it say I'm say dog boss so but be a one shed anti brush there after every 3 months biano. Yeah, you didn't say or say auto new one and I saw system.
After every 3 months.
After every 3 months.
Then say a cry. Me just say I no why a bye. This was a tree brush and I no. It was the way she left, the way she right no. And I was so samba. And yeah, she did 3 months today. Say yeah, she 3 months didn't do baby ayo.
After 3 months, we share based on what has been observed now, after 3 months, no, the effectiveness of the bristles now to go in between the teeth and clean and do a good job, no, it goes down, it reduces very gradually. Obi will cry now or top brusher in those 3 months, but now with bristles because or they are one dimpa and so you see or you see na one dimpa the chin is no and or yen in such a way say the bristles gets flared up into standard no 3 months every 3 months piano you have to change your brush.
Okay, but what yes every 3 months I was say also start with brush. Sorry for the phone line is still activated 0301711 03022435547 03022435547 and now 03022435529 my activated phone lines. Hello Mohoyana.
Pacha
Me pa chodi ni baby akase.
Mpachon best your friend me akweli if Kolebu.
Start kwele mpacho etie o.
He said yes see like ube obviously or treating is several times or you so much watch but still like sent to nanu and I mean say ye eba musa like a tumu yare free utrimu mpacho ampana
Doctor mpacho ampana
nti edikan aka say halitosis no and also is a very broad topic ebia no so betimi apɛ brand ababe achichim but just to answer your question ebetimi akoba say ebia wo twitwi ne sen oye we ni nyina nti me kwa me di kan obu wa ha obeka so oye but ebia no onye no te say de ese so oye nti na afi so ebia nanum halitosis ne dey about 80 to 90% na free enum problems na nti obi a wo halitosis ana wo nka wo num oko clinic and oko hospital the first place I'll be called down a department I'll be called a dental clinic because most of the time no ntibu to say to chew when yi and I say oh yarebi wenum to say I mean it could even be like a wisdom tooth issue be when you swollen gum be or and obetimi akra ma onum when you kan onum ebetimi even an oral sore betimi am onum but most of the time Nayana is about plaque nibble diani idea about these microorganisms in feeding on ekofasa produce this offensive gas na edebano enti meka se onyanko hu dentist konko hu no ne assess no ne hwe nanum ne hwe se problem bi anima se hwe na se bia nanum no ye cheche ne ye clean man no ye se bia ye hu se you making sure say bibia or cavities crown and you making sure say bibia okay and then if it's still persistent then you do the referral to the next we are to say be an ENT surgeon and say be to diagnose be or any sinusitis and I said could be only 3 man as any other issues I want to assume any minimum I bet him is so address but about 90% nenum and I say a dental issue.
Okay, but dog, Biamuka say nipa no doesn't clean properly. Hello, sorry, my fakwa name. Hello, Mohoyana.
Yeah, hello, good afternoon.
Good afternoon, but you didn't be free.
My friend is Ami Urinchi.
Mr. Urinchi, Pacho, it's here.
Yeah, Abigail.
Oh, CEO of HF Grills. Me Pacho, it's here. And then they were fresh show no so. And they were fresh show no so.
They are more discussing and in fact they my own experience me to say doctor I can say omo munya to take amana kakano. Na omo time to chew omo see and so omo to chew omo say whatever.
Sana kai.
Take good care of you.
Sana Dr. Annang kai.
Oh, okay. Fine. I mean, experience in I don't know. Maybe I know. I'm better me video. I think about 6 years ago. Me too me say back. That was 6 years ago. I was Excel for catch on some fancy man. I'm bad at
And the Dr. Kwabena Amponsah-Kodua or how what's it?
The Ecoban is Abigail, and I said, okay, doctor, some here. Ecoban said, no, me toothpick, you super. Me send here the type and I quanted them. You see, the beer made the beer even bread crime depend on acquisition. Until me use toothpick or me simusa, me do baby, no me the toothpick in the show, and no mujeba. Me the show and no mujeba, me the show and no mujeba. Then eventually, I say, go to baby. Me musa say, na me send us a starting. And I say, move that to cook. And then I didn't go Excel, no, I'm to me send a man. And he said, me so me contribution, I can say, man, toothpick, you soon say another a year. Because soon I'm only a very sharp. I think say no so to me because the other type and I'm said here. The said yes, I time cry and at times cry. I say, me did you cry just me brush at me. And we are cry, I just say, aha. No, so still this happened to me.
No, okay.
and meaning say doctor won't be obeka.
Okay.
Say foot will be so hard.
Wait there, so baby I will send one a direct question now. Dr. Kodua, it's you.
And James said the okay nyina kosi say I mean no use then toothpick. And I know Ankasa who say the how be brain a brain. And teacher say we require the ono Ankasa from the experience and an example. Where the Obama we work no cry easy. So the bear will be a crying who say be a theory be a NTRC and Eka. And teacher say it's not advisable so be used to toothpick, you know. So because I don't know one, they said the okay only a sharp and two soon. Into one case out here was sending tema all day sad nation and with time a bit me a widen sa we no interdental space also I say no it me move it the boy who piano sa apply pressure no sa kaka ni move and I feel so for so ne be so na say move a bit me I am it's not even advisable into as I say we use dental floss into any ye mumienu ye baako e won sa ena obaako et say ahoma no tia na obetimi ade ayi wonse ni ntem no ana say bia opese we use opede so kakra bia your interdental brushes and so you can also use and also so like a swa ebetimi a go through some spaces wonse ni ntem
Okay,
na Mr. Insurance na obeko dia tu ubesa di bibia ko rawu simumbiem.
Oh, me Anna actually like because me send a quantity them. As me deep bread cry. This say me just say me day.
Oh, okay.
So this strategy I me adapt and say me did we be this say me see jam and no me day. Woman be me di be just say.
What say you send me message no ni raise onu munsuo kra no na o yinisim. Bye bye. So live on OK 101.7 FM meeting the Abigail Ashley. Dog kasam pacha.
Nti kakra na me person de ka ho say from near color the kind bo say toothpick na odishe ho I do be na fe de who say moja eba. Ha na no say na also who say enye normal because say moja tase ba panya just say you are causing injury to some part of the tooth, and most of the time we won't say periodontal space no, and now say structures now you can say a socket into all the toothpick show pointed object constantly no, causing those structures to be weakened. And also can home a senior weak. Say a dog can say we use toothpick constantly no, a mouse in a week then bones say in the end no. You lose that tooth and I say Baku.
So live on OK 101.7 FM meeting the Abigail Ashley. I have in the studio Dr. Ransom Annang, a resident dentist, Whitestones Dental Clinic, Omuwa East Legon. Sounds so enamiwo Dr. Kwabena Amponsah-Kodua, a dentist, Excel Dental Clinic, Omuwa Abofu. Achimota omuminu nyina ewo ha omunyina ya dentist enne yes ye ka oral health day nsem ni bi dey say happy mouth happy body na dog nam person bisa o the correct way no to clean the teeth no de bia musi yenye ni ye anything what's the correct way?
Okay, the about toothbrushing and I say uchuchu say number one idea was say me to join say enye gidi say uchuchu say ama I come on enye by force and I say enye say holding be and I would be choosing we share brush most of the brushes see no who say why no zigzag form it say bristles no has been designed in a way say it a bit to me error the hidden part and I say ntoko na that esenu intem no inti o brashia especially the side of osina between your cheek between the cheek and the tooth no enye back and forth and I say odi share ho na u moving no back and forth and no sa no it doesn't help. We advise say you hold the bristles at least 45 degrees to the tooth. And say you find say o brush upper teeth na. We share upper teeth na stand upright and I say it comes down into just imagine holding your brush at 45 degrees to your tooth. Then you brush in a circular fashion and I say in an up and down, more simplified form near up and down, but the correct one is over in circular.
Yes, up and down. Now you rolly brush no. I say
I say we draw circle cheek in a gentle fashion. You apply a little pressure to the brush into the
what sorry how much 3 years so be do free now be see traffic here o me nothing now be now I say you say
would you believe say that 2 minutes and not 3 minutes now would be brush so it can save you from having a future appointment then the whole day no to me kwejuma into just 2 minutes into within that 2 to 3 minutes now the brush it goes a long way to save you into for your schedule is tight and you just try maybe squeeze a little 2 minutes or 3 minutes into it's an up and down motion or circular fashion but the side now what they side here that side no obe to me back and forth. They said the normal way amount for that's the only side that you are allowed to brush back and forth. Then your tongue obe brush your tongue utekrama so obe so kama then the roof of your mouth and I say ohwe baby a utekrama eka wenum top part no ahonso ye an area or say odi brush no efafa ho nyina
esro ho nso kan
yes esro ho nso eka ho o brush ho no nyina area then you can see say you've done a good job of brushing.
So in all how many minutes should it take?
Or between 2 to 5 minutes now but maximum by 3 minutes.
Okay, and yes, sorry, I am set time I debate yes. Stand up a
yes.
Mamincha Mr. Harold Roger Cote, me want to abaline so share. Mr. Cote, anyami? Oh, Coach Banku go keba nenko. Oh, why left you? Banku came on me for. Bombo. Maybe I will be a micham we ne so live on OK 101.7 FM and I can oral health for some dog. Me per se share some of the likely diseases which are to affect your oral cavity like yenum ebia yen fa yenim yandwe ho krapo say esia yandwitwi and the buy feel say kakape but I believe that there are more that is likely to affect us one choose. Can you just give us some few? Now me can share phone national phone service still live on air. Phone lines are still active 030-224-3547 030-224-3547 and now 030-224-3529. You bet me some of the likely them bet me affecting yes.
Okay, inti a dorsal bebre inti bet me a few na I'm sure some me colleagues also e be beka ho inti said they would kan kakao de obi enim o se be o ya inti ana esa common ways so bleeding gums obi wo ho so twitwi se kakra bi ana na moje eba is a common thing I am for experience and so area
me twa no but when me say ade na me fo say obi o twitwi ne se pa na ne mojaba
oh there be
and see the biara me see because we had a cousin who lived there you know o twitwi ne sia na o yin di na mojaba na me say and me twitwi me say the na mojaba banana later na me who say it wasn't true but then this ade na ba
they know they say one ebi wa ha twitwi ebia o twitwi ne denect said you akofa brush bia no den a o twitwi but most of the time they akofa ba no boni friend gingivitis and I say gingival disease you know say gum nankasa I inflamed and I say I just say I am and I say we inflammation I hono we na ha ti yare abem yan fa ne sa enti and the my yare so bem so once you car plug in the have you know yare about num bebre na efi ti number 1 even though say I mean, there are some factors, even hormonal factors, and other even in rural crowd, to say be antihypertensives, but most of the time, you know, I am a plaque. And to say, won't you choose see, and I say, or send a fee, and I won't do a numu, I bet me and bleeding gums. And no, not just a start here. It's not just going to end up with when you see an choir, it can progress, and then it will make you get something. Maybe a friend periodontal disease, a memoir will lose so, and now send no crab to a free ho. No, Anna, like a bleeding gums in a timid coba. Apart from no so your halitosis and I say bad breath and so MC I can't want same kakra we can say sensitive hypersensitivity then TFN dentina hypersensitivity obu ha na ne se obeka se ne se frem no odi ade a de enyunu ye kakra bi ana ne se frem no a problem so etimi ba enuma eno so ebetimi afa long time to talk about that. I mean, wisdom tooth issue like kwalana already from 80 years and the young adults, you know, mutiminya swollen gums or most of the time mutimi clinic bana onya discomfort from an erupting and I say wisdom tooth fifi aba. You can even have ulcers afters and I say ulcers etimi ba yenum itimi kuwa itimi ba yenum. And to me, talking about ulcers, you know, unim say, your friend is saying other, even some sexually transmitted diseases, but it's a syphilis, any herpes, anyway, everything else was by yenum. Apart from when the afters ulcers, you know, crying shadan who the ecofaba potty, but it's me by yenum.
Look, pause. Who's this syphilis?
Yes.
Syphilis are Bemani Bemadana Ebano.
Yes. It's me manifesti wo enum. Enti ebetimi manifesti wo enum, ebetimi anya. So no.
Chen doctor tobo. Abutre. Syphilis na bema na obada na omo ehia wase ho. Na ebepie wo enum.
Yes.
How?
Even akola okra yawo no kra no ne se kra etiba no. Ebetimi a kire say ebi ane maame anase ya pass it to the child anase onu so anya bi. Yes. Even though it's a sexually like idea ultimately sexually no, but it can also manifest in your womb. In a form of the sore and your friend we know the teeth in a timmy boy and look at Hutchinson and I say it's the yes and you should be to me about say like sir we know even aqualano the way and say ya wa kwala say bia or syphilis and at any mama de amana utimi enya some necessity me shaping in the form of a friend is a mulberry or something. Yes, it can shape in a way that can depict it and matter say normal lesson I but you who in the clinic you know say it's akolano yes syphilis yes it's a sexually transmitted disease but it can manifest in the mouth even HIV so it may manifest in the mouth kaposi sarcoma other things person make one thing these even some diseases are until they can say the happy body like who keep you and and I say who you know and I said there are also some diseases I bet me are manifesting you know who keep who dental clinic checkup and I say show no ya mpa say I already banner say yen hu nani muntam mpa by examining your mouth no you bet me ehun ni ntem
dentist no crab hu ansa na adede ni wedi and ask him to scratch show body or the doctor
yes
once you are the dentist you can even see it.
Yes.
Say, hey, you are likely to be then. Wow. My main show mom sharing live on our Facebook page. Eddie Insa boy mo sharing Mane Takbe. I hope I got it right, but I'm fetching my wife. So and Miriam Ajimai on also sharing live on our Facebook page. Gracia Joseph, thank you so much for watching us. Joseph Deborah, Yedamunina, somebody me video no at OK 101.7 FM. Samson Afrempon Emmanuel. Piaga, I'm enjoying the show live from Achim Asafo. Thank you so much. So we do a video at Soha. Ajua Enim, so sharing. Thierry Makweta, and also sharing live on our Facebook page. Mustafa Jabril, thank you so much for tuning in. Etienne Magdalene, thank you so much. Shintua Shiko Topopo, and also share live on our Facebook page. Roy so sharing. Samson Abdul Ralph Safi Su Shen, Isaac Kofiata, thank you so much for tuning in. Nana Safo Benjamin, thank you. Drew James, thank you so much. Francis Kujo, Kwame Amwa, Frederick Anane Frempon, thank you so much for tuning in. And Judesh, thank you so much. Sansuna Premier Holdings on social and live on our Facebook page. Mohamed Mefide na to nyina that must say. I mean show Bibia Baba Yosen social Francis Kujo May Nyame social MD Kamal Hussein social Munina Yadamunya say Sophia our chair Rita Foriwa Martino Tino. Thank you so much for tuning in. I mean, show be building the video na atua. Me pa chomo share page ni na mo share page no, na mo like page ne. Mame, me damu nyina say Kennedy Asante. Thank you so much for tuning in. Baba Yosen, thank you so much for tuning in. We love you all for tuning in. I mean, show be bia. Now going back to the World Dental Day celebration. Happy mouth, happy body. Your sick tune and now Mutima Modeman this year World Oral Health Day, you know. I really love it. I really happy mouth, happy body. But how are we going to implement it? How are we going to do that? Meaning say we are doing our part here as we are sitting here. The dentists are also trying, but do we have enough dentists? So Biakase or bad dental clinic, do we have enough dentists to take care of Ghanaians?
Oh, for now, the statistics of Ghana no say if I'm not getting the exact figures, no, one dentist is to about 10,000 patients. It's a doctor to
patient ratio.
Patient ratio is about 10,000. 1 to 10,000, which means say dentists population in Ghana and Shada and Dawson. We need more dentists to offer services. And even the distribution of these even qualified dentists who are in the system, we say most of the dental work is being done within Accra and a few cities are the infant said they are endowed. But we call hinterland near other regions now. It's a bit difficult. Say we have a dental problem. I'll be near prompt and quality dental care. We are also advocating and hoping say more dentists will be trained, more people will become aware and report their dental issues. Send a bear, more care can be given. And even to just to buttress point the last point, Dr. Eka about some of the diseases that can occur. No? We share the theme, a happy mouth is a happy body. Dentistry also translates into even your social well-being. We will say from the Kwabena or is into tongue sucking or sucking a thumb, and I say or sucking a tekrama. All those things can have effects on the future teeth. If I say permanent teeth, and into those things, we say you say your friend be seen with glass. Ni seno APP or katane nano abon se ni seno APP. All those things are dental issues, sir.
Dental. Oh, okay.
Yes, most people, your appearance and crack can make people have a certain mind and a perception about you. People, it has been found say the way your teeth appear, and people use it to prejudge you, and before you even speak, you know.
Yeah.
And so all those things come into play. The psychological aspect of dentistry. And I know say one.
And since that's about rats, no area.
Yes, yare. Your be increased overjet, and I say a combination of problems. Sometimes a skeletal issue. Sometimes also a periodontal issue. Sometimes also here say obeba for assessment. Now you're checking you who baby are folly. Now all these things they can be corrected. Who go through some of pictures and procedures of past patients that you're corrected almost you'll be amazed before and after pictures of patients are about with dental problems. Sometimes affect their confidence. The confidence at school. To me, because Nadam for phone now I say so a happy mouth is indeed a happy body, because all these things apart from say yare and I say pain the psychological aspect of if it is worked on, I won't say it improves your social status. Yes.
And say it's possible say to me as money in and that brings my point to recently I've been seeing a lot of people with these braces. Obia na me because me ashebiana. Me also Obia ashebi. I don't know whether it's fashion being so I don't know. Is it a fashion or is something they are correcting?
The braces there, it's therapeutic. I mean, and shouldn't be for fashion and for me,
Okay.
because so yeah.
Because me also na say for be brace.
Almost
na mo say na. Dog almost na mo say na obi hu na sa na de no sha. Utumi nkata wa no.
Because na onu medro so untimi nu medro abra like onyare. So it's for a particular cause.
What is it? What are they doing?
It said there na me colleague in Kano to say there are a lot of malformation I bet me about like oseno neshesheno any the we are even the position and you see be an neshesheno cry like the baby see ebu ha na and see anti ana ebu ha even the way our facial profile nicity Africans any be abrofuni ubia there's a normal profile and I say yeah it is a utiminya inti there no if it's not normal it can be corrected. Said a bay I bit me and the common one I bit me explain my tears and say to say the we was seen see as she no maybe and she be about a straw the no once a John I say the was no a see the war a form like a sliding over obi dear or her I slide it too deep and obi also there her at a sliding a coin a project a so there no upper jaw no coin him esni bebre esni once upper jaw no ese ba nanim kakra ba say ko bebre budi no ko nanim pa and ebu onzo ane lower jaw no emom e nanim anane upper jaw no we three entini na ye abnormality the other way no so the way see ahihye no timi ebi akeka bo ho bebre ene ebu ha estro de nti there no so ya another topic I betimi account braces you know is able to correct it, and even now cry we are there is clear aligners no so timi juma na braces ni timi ye ni bi nti timi so no so timi hye ese no correct no nti ebu ha na ompe say or did that dear beshe ne se so now did that dear because that any bit me baby is a bit uncomfortable obi won so person baby be on person be abi hu say wa koshe or ye bibi they are correcting ne se and you can also opt for clear aligners Invisalign and no so bit me adwuma ni ye patch asimi ahihye wo senate said ye open no
All right, so it happens. Still live on OK 101.7 FM. We show with Abigail Ashley and a oral education. Near Bay, I see a boy, yes, home by. Inti dog said braces and yes, see and your fashion. And go for the correct or moniama. Inti na who say in Kofunum. Now, dog, wish me say from afar. Do I need one? My family is son. Do I need one? I am be okay. But still, I'm better me show. Because we're not more deformed with son. I am a fair.
Oh, bit me about for a more closer assessment. I know dear here. Sometimes we from afar, wait me a little error. But for closer assessment, dear.
Before, okay.
Any kind say, oh, how so me percentage braces. I just say, my dentist a confirmation.
Yeah. Okay, so you need a confirmation.
Exactly.
To me inquire and say missing percentage.
Sir.
Okay, but we can still squeeze some few calls. 030-224-3547, 030-224-3547, and at 030-224-3529. We can still squeeze some few calls. And then how if I was saying question be also beside doctors na fi why worrying pa say who to work or show was na me pacho friend 030-224-3547, 030-224-3547, and at 030-224-3529. I have in the studio Dr. Ransom Annang, a resident dentist, White Stones Dental Clinic, Sanso, and Dr. Kwabena Amponsah-Kodua, or dentist, and also Excel Dental Clinic, or no woman chain, and her area way. Now, doc, Mammy Bissau, like Mammy Bissau doctor way first. Excel dentist. Then I'm with you. Let me just give you a chance to just market Excel Dental Clinic today. What exactly do you do at dental? And you're in person, but the company in general.
Oh, okay, so I mean everything dentistry, from cleaning to fillings to root canals.
Fillings near then.
Chede be ame chichi mo kakra nti se cleaning dey apart from say one kasa wo cleaning o se no ye chichi ma yetini from this education who say you may clean do your bits, but in with time there will be some build up, and then will be see what you say still when you have issues. One person after the obey, you have a limit. In I can say every 6 months be so bad so you take it further near cleaning amount. Failing so you know different types, so we can have the normal failing to say composite failing, I mean GI failing, and no we just baby are the defects and say they are toku that will seem and I will see no baby ebu. That's all per se you're failing now to restore it back to we and the normal anatomy na ebiti me so I am. Obi won so anaka toku abedani sim na fi a progress beyond we know nafi a starting year no ba we may not do the failing based on the assessment assessment need take it extra. We may have to do something called the root canal treatment. It's be as a senior or yana say person be too senior few or senior quite over to a few home put the energy it has gotten to the extent say but because of the education and training to do he just comfortable with the own him into Oba. He want to just do or say Oba. The extraction is the only thing that can be done when he's in pain. But as a senior say who say we can save the tooth for you. I bet me a root canal, something called the root canal treatment. And I feel so bet me so braces so or say be as a osino and she ye and say we can tooth malformations in it is a way. We can also do that, and then so what have I even left? So everything basic, all the basic we dentistry and advanced dentistry, whitening, yes. So like this. A lot of people want to look good, whiten their teeth, brighten their teeth, and all that. So we also do that, and then so we do replacement tooth replacement. Maybe now also so seno for some reasons. Maybe Amponsah-Kodua and as waba in the waba clinic na ye two cinema and as one kasa kobo baby amane today you want to get it back. Say I can say sense so the me amount the confidence and all that ultimately smiley and then you want it. So there are several options. You do from dentures to implant. So dentures near removable, replacement now but in there into no cryo types. We have the acrylic and then we have the VAR plugs, the flexible. The acrylic near rigid denture no. And then we have flexible ones and also so obi or how the flexible shift for empty pie. And then we have we do bridges and then implants. So tooth replacement options that can be done.
But your message or dear boss see no cardon pen and it's in subuye and no near bend diamano.
Or but for assessment times you can either do a simple filling or we can do so depending on the extent, then we can even think about crowning, putting on a crown for her. It's just from a filling to maybe a crown, and if it's in pain or something. So based on the assessment, and we know exactly what can be done, so it can be restored.
Okay, and see, Excel filling station, Excel dental clinic in the one side.
Achimota abufu.
Abufu infaside. Obi
Achimota abufu into around the Achimota new station there's a shell filling station on the Stanbic Bank building. Is on the first floor. The building in front of the Stanbic Bank. And so from Monday to Saturdays.
But your time at the same time and I'm what?
So from Mondays to Fridays is 9 to 5 o'clock, and then from Saturdays is 9 to 2 o'clock.
9 to 2 on
2 p.m.
Okay. White Stones Dental Clinic in Pachomusumu Hono then I'm way.
Okay, basically we also do all the dental procedures you have from fillings to extractions and to dentures, so your replacement. We see it to now per se your replacement that you different types now. Dr. Abubo also know we are also able to do all those things. I think so. Your orthodontist or your specialist for braces, and so for initial assessments, you get a booking to also do braces if the need be. You can't even with the replacements and all the way up to implants, the same thing. To me, implants with our specialist you're more on board. And basically any problem if I was saying hobiano say whitening, say even if you don't even just like the way your teeth are now, you want an opinion, you can walk in there or even book an appointment or bar your share not be the options in number 2 and now
what you do there.
Most of your per se you know why you make a decision your child say wait there wait me wait there won't me open way, but you share there would anything or the way I was saying anyway no etia we mumbe bow now what you want what you say that figure yama wenti basically all dental treatments are that is available. Root canals be our hoye
so the Mr. Excel Dental Clinic for but most location no one.
Okay, your location was easily gone on the La Violation American House Road, just after the Malcolm over Malcolm home. Now branch I say we call American House. We are close to MTN office now. A bank. Was our road to opposite MTN office.
Okay.
That's where we are located.
Now, time because the young for now or more year almost scheduled now more the account.
Exactly. So from Monday to Saturday, you start at 8 a.m. now upon 5 p.m. every day.
Every day. Okay. Now Dr. Kwabena-Kodua, maybe can someone just walk in or you always have to book an appointment?
You can walk in, and then you can also book an appointment too.
Walk in and book an appointment too. That's your own convenience. Okay. na wa ba honom na and what oral health dem it is an uncle for ye free screening bi mo manye bi mo ye bi mo anamo wi
and yes you hear there ni
na e be se be direct traffic into na me bisa na eja se me bisa loka se me bisa na white stones na mo ye screening ni bi mo ye free screening ni bi
oh yes
to be specific
yeah free screening but it is up till the 3rd of April.
Oh, okay. Move here from now to the 3rd. Okay.
The 3rd of April. Obana, you want a free screening now, you can always come and have a free screening now. Also, so a 20% discount on all services if you are able to do any treatments. I have about 20% discount.
Okay, so you are doing free screening from now to 3rd April, right?
Yes.
And move here 20% discounts.
Yes.
On all services.
Yes.
And they will send the power bound more. No budget discounts, maybe.
Yes.
Okay.
Because time limited, short, you have to try and make time now. At least come and have your teeth examined. You can't say when now, and I say when you are supposed to do. Then you can go and then know exactly
what you have to do. Okay. Now, your ban toothpaste, maybe a trim. Now you use your friends and Saureno, near the abo bidi. You be catching and say be a no end. It's and saying who say paste that be now be go back to friend is saying your friend is saying bidi ibium. And see besides said yen come back to our titi. Way of brushing and still mo be say ko dia mo chen ya e je na makofa titi de ni bia be fra what should we do? Someone's question is asking and I'm wait them I'm fan bi someone
auntie and I'll be answer
because we used to do na ye bu body etia na de abo bidie no na ye de twitwi yesi ye betu ye na nam no mo yesa etia dentist yi ba ye na enye yankoto yi nkofo yi paste yi bi na mvan twitwi yesi se paste na nkofo yi dia ba yi bidie na eno mo da paste na
it is say bidie de untimi nkase ade nti e friend say wo you can't say etimi etwifi if you win it won't say if you so be cry no poison and as you do niyem cry na etimi man emani enti na say an cry no ye you say the all can confo even a new toothpaste no mo de eka ho no but say ni bie ko nanim enti we cannot go back and then use the same charcoal and then I mean we your body in teacher say no crying to can you even reuse it and I say obe store no saying
but they know it's efficient
but I think me body cry me who is a BC baby cry check until where are you even going to get it and because of convenience new technology no ana be more etimia I who say a bit me because charcoal no it's etimi a cleanse but yes who say we na nkasa no toothpaste na nkasa no so abrasive component so ma and so titimi twitwi we no it is one nkasa na say who use we na I'm sure say omono from their formulation they've been able to proportion it in such a way say bia too because charcoal too is an abrasive and a toothpaste na nkasa so ebi wom nti omankasa they are able to formulate it in a way say there be a abrasive portion no endorse be because and also boroswa a bit me akofa or how about but from their formulation I'm sure they've been able to do it and then you can combine the properties of charcoal etimi etimi chifino and then combine with the toothpaste a bit me amount a very because when say who clean or see up say utimi homa no efino and the plaque na ho nyina etimi ko I think it can also do a good job when once idea which has been maybe a food and drugs board for our clean products and then it's good on the market you can rely on and then it will help.
Okay.
Me fa kakran son kauna wo hwe tete way na ye de twetwe omri say you see charcoal anybody
tea ana charcoal ni sorry
yeah now ohwe modern way na you see toothpaste with brush the main difference one of the main difference I bet me say fluoride is fluoride content in the toothpaste na you use it's not present in the old way na ye de twetwe na you himself fluoride so eboa ma prevent caries and as a kaka balls and the fluoride content na most of the toothpaste na about so far if you decide to go back to say you see charcoal because ebema will see na your whites and as ebe clean will see ye nkwa then you are going to miss out on this fluoride na toothpaste which later no so be to me amao problem to say kaka ni tokua ebeballs nti it's true said and say yeah the charcoal paste toothpaste number but osha to say the way I do kind the proportions now omode ashemu they have made sure say the abrasive component will not be too much and at the same time fluoride content so bewo to help you to be able to prevent caries. Inti yeko yenim na research course inti so omo say charcoal here then adding it to what we have is the way forward.
Is the way forward. Inti we do the be hu say sare no so ana dia wana say ere no say ana inti ana ye chen
say yeah chen researchers inti researchers here.
Banko for that zuri friend said dia wana.
Yes.
And it's good. And now so mo for fluoride in count.
Oh, so fluoride need it's very important. It's very important. Okay, established research actually say it helps to prevent
but it's the same fluoride people are using it but they are getting cavities.
Who say that is what we are saying with other things also happening apart from just brushing. We are treating this but on keeping the same year.
Okay.
We I just said the next day.
Just the next day.
So okay. All these things, even though you see fluoride toothpaste, but he's not also observing other oral hygiene practices are preventing.
Okay.
And I'm sure medical cracker. Sometimes I appreciate like interceptive measures. Who saying KBA can use fluoride toothpaste now? Ebi a cavity ba akopena we hono. Ebi could have been more than that. And it's really helping, but ebia. So if say Bianca were new it could have been worse. So it's fluoride, it's very good for preventing cavities.
Okay. And yes, sorry, so crying for today we did oral health and now oral hygiene and mostly I'm fine saying how to take care of your oral health. Yeah, discuss maybe you said their doctors not in yate, but yate say be ya na yate say fire soon. And also another issue. Dr. Ransom Annang Onoye resident dentist Whitestone Dental Clinic. Also na Dr. Kwabena Amponsah-Kodua also dentist Excel Dental Clinic. Omumienu ne baya ni omu eye discussion. Na iya sorry so kra no e den efutu na mode be magana for ansana. Ya sorry so.
Okay. The baby I can now is about creating awareness for your oral hygiene and oral health. To oral hygiene, no, say ube sorry and no power which you say ube da enumerate so which you say and sana wada. Now we take good care of your teeth and your mouth in general. No, that is what is going to translate. Say wow ni pediano be wapomudem sembe koso. Now also why happy as a person because a happy mouth is happy body. Ye per se most Ghanaians and I say amount for multi should start taking more concern about their teeth. Ebia o honauti utin kakakra or usin warning signs. Who said ugam ni bleedi kakra. Those are all warning signs. Men train ma usino and start to say ya bebre the whole night to mean that ana afi the open dentist and now open baby akotu sin. Yeah advice say ubia be take good oral hygiene practices na wo de aka wa brabo ho nti wonim say me de way a metie no me ntwetwe me sia me ntumi nda ana say me didi we na me fa nso enhohoro me num ya and then me nyanwie all these things no ye de kan ya brabo ho a it will go a long way to keep our mouth healthy and in the long run your general health no so be konani.
Okay. Dr. Kudia.
So me the kakraka hon nti say yeah cap prevention nti broni beka say you about 3 types: your primary prevention, your secondary prevention, and then tertiary, and then maybe a rehabilitation. Nti there's a make ni nyina kwesi say primary prevention is say o better say the area ne kra ma o twitwi o see o wan kasa your own doing the things basic oral health we know. And then the secondary prevention is say bia say ebi obetimi aka so why ni nyina but ebi what to say when your problem upon doing the way nyina nti empese yare no ebe ko echiri bebre because then to share na comfort doing say ne boarding dodo me kwa mo charge me too much nti wadwen ho say o twen ama yare na ko nanim bebre no. Have you thought about say how because say osini eso anadwoa untiminda o obaba hospital obabe procedure then that one there you pay and then you do the procedure in the time enye oya na say you are about to you can find a convenient time for yourself adding na omba into upon doing all the things that you have to do say ohun say unya problem bi ketu ebi so ana say ohun say bibi nko ya say okọ clinic now muti yetimi hu ni esi anon temma because dental issues in a betimi aba from any other thing, cavities, sores, and betimi to even oral cancers. It can be something that ain't chadaimia to say be a tokre dowsing, but it can also be something as serious as early form of an oral cancer. Secondary prevention is better. So the baby in term na prevent so the bear on koboka bibri on spend it on waste productive hours so the bear also so ubetimi any sky on your mind until it's in term it's less expensive and it saves you money.
Okay.
Thank
you very much. Mampacho manje mo contact nkofo bisase na mo numbers ne nti mpacho so mo de mo numbers na betu dwa mamia na for easy location and maybe a feather see some of the numbers in Betty Drama.
Okay, into my contact here is 054
Dr. Kwabena Amponsah.
Dr. Amponsah.
Okay.
It's 0548 078 096. 0548 078 096.
Okay. You can reach him when you need help regarding any dental issues. And White Stones for my number, my contact near then.
And so your contact here 024 22 51983 024 22 51983.
Okay. It was for and aha and at time bema akuju edi ejumedi no abewie ma menja monemu na me faseta pa ema a doctor for me no a omudi omuhu esi o se na ewie on ba betu yefo afa oral health na Dr. Ransom Annang a resident dentist, Whitestone Dental Clinic. So and a Dr. Kwabena Amponsah-Kodua or a dentist, Excel Dental Clinic, or Mumienu, and Omobaya, or Mabatuyan. Me pacho, you would dear film because me my immediate film. Na yedi asida pa ene momo yedi ejumedi is here me producer Sami Otavi, executive producer Dr. Father Dixon, mo share mo free nyina mo sending your messages nyina so yeda mu nyina ase obi anhwe ne hu ye yesi wan twitwi wosi akaka no ene deba na Dr. Amponsah said last words or the man say or say prevention is always better. Na obebo ho ban sendia awmachi wa sorry eye wo kaka nso ba ana esi are minim de nti ade na anadwo nkwa na ejuma anadwo na ega o se afi na odi mrika ukwakope doctor sata na doctor ada o hwa nkromo won ta mamu ye ejuma no o mu ye ejuma 8 am to 6 pm and tu nim na okaka ba 10 12 wa just ade echi azana ba ko hu doctor ntimpacho doctor say entwen emma ebi nto ansana wabehwehwe a doctor ni ichiri nti ama o two options Excel Dental Clinic e wa bofu ha ya ai abofu ha ya uduwa ubehu Dr. Kwabena Amponsah-Kodua ewo hono obehwe kama ana so beko East Legon na wako White Stones Dental Clinic Dr. Ransom Annang enen nkrofon so ho omuso duwa ombehwe and I read two options and now pe wa ho asem kolebun so ho rage wo ho mamobi wo ho amasama so clinic wo in ifa clinic polyclinics no baby but dental service no say town doors and now co private now unya eyi we be say preferential care what you say so just choose the two of them me the money na ma numbers ni biom Dr. Pacho bet me about numbers ni biom obi a want na Dr. Amponsah-Kodua wo number ni biom Pacho
078
Pacho say
0548 078 096.
Okay. It was the number now to JB Minty me. Just say wait here, watch show. Sounds na White Stones Dental Clinic. Pacho number ni biom
024 22 51 983 024 22 51 983.
Okay. It was the numbers na mamo biom. Said I'm more request here. My son dia mamo biom. And then they made the see her. You see twice a day. Moon brush twice a day. Anya be crano, ube born by every cacao. And no yano. Apart from them, the Akaka can in Pacho. No born who by every cacao. Medin the Abigail Ashley, that's an ebishibium. Nemum kai say, obey wa famudie. Nanyankopon so aye na famudie amo. Wanya wo dia e be de nanyankopon be ne die amo. Into bia enye na famudie. Nanyamin so eye ne die emano.